This is a patient that we saw that had a number of areas of class 5 decay. On this x-ray, you can see that there's some decay on the mesial aspect of the second molar and on the distal aspect of the second premolar. And clinically, you'll see there's a good amount of decay on the buccal surfaces as well. So in this video, we're going to be restoring these 3 teeth with class 5 restorations using Fuji 2 light cure. And we're going to first begin by accessing the 1 or 2 millimeters of clean, healthy tooth margin with a electrocautery tip. And then we're going to get to removing the gross decay with a large round diamond burr, and then the remainder of our caries removal with this small, slow speed round carbide burr until we're back down to hard tooth tissue. And then we'll do the same thing for the second premolar, removing the excess gum tissue so that we have good access, which is critical for a good apical margin. And then remove the gross reduction with the large round diamond. And then final caries excavation with the slow speed. Fuji 2 is my material of choice for these types of situations. A little bit more on the first premolar here. You can see the 2-3 is also prepped for a bridge, which I'll probably post. Going to be cementing that next week. Going to condition the surface of the teeth with a 5-second phosphoric acid etch, which the literature has shown is just as effective as a polyacrylic acid scrub. And then overfill the cavities with our Fuji 2, tamp it down a little bit with a cotton pellet, which I feel just kind of maybe gives it a better bond and better margins. And then remove the excess restorative material with a carbide flame burr. Gums are going to bleed. It's hard to avoid that. These fillings are not going to win any awards for cosmetic dentistry, but they will prevent the progression of the tooth decay. And then once we've finished the fillings back down to the structure of the natural tooth, going to apply our varnish Equia coat. And I use that coat material even for Fuji 2 light cure. And then we'll get to going on the molar tooth, same protocol, removing the excess gingival tissue with a electrocautery tip until we have a millimeter or 2 of healthy tooth. And then caries excavation with the slow speed, and then refinement with the high speed. A little bit more on the mesial lingual aspect there we're going to get. And then same restorative procedure, 5-second etch, thorough rinse, dry, mostly dry, and then restore. And then we'll finish this one and call it a day. Thanks for watching.